As I sat in the circle listening to the staff, reflecting on their experiences during our poverty simulation day, I couldn't help but think about when I first came to Alberta. We had filled a U-Haul with all our things and drove across the country looking for farm work. We had almost nothing to our name, and although I didn't know the words for it, we lived with constant financial strain for years. I remember at the time, my health was just not a priority. We were just trying to survive day to day. As the Executive Director of Kalina Country Primary Care Network, I had agreed to participate in a pilot project looking at reducing the impact of financial strain to improve our clients' health, but I had become uncertain about it. It felt like there were too many unknowns. What were the causes of financial strain? How could we support people? Was this even our job? Staff were understandably nervous about asking a question that opened up a can of worms that they could do nothing about. There was a lot of fear and apprehension. As healthcare workers, many of us were far removed from the experience of financial strain. So, we decided to do a poverty simulation exercise to help us all understand financial strain, or for some of us, be reminded again of what it was like. After that day, people seemed more willing to begin asking the question, but I knew we still needed to take it slow. We started with PCN clients only. One day a week, we would ask 5 to 6 clients, "Do you ever have difficulty making ends meet at the end of the month?" And each Friday, we had a quick PDSA conversation to see what challenges arose and what modifications were needed. Early on, it was clear that the list of community resources needed to be adjusted and refined. We needed help, so we reached out to the community organizations to make them aware of the project and asked for their input. During these conversations, relationships began to develop, and staff began to feel like they knew who to call if there was a positive screen. Working together, we developed processes around charting and handling financial strain information. We found that for many people, financial strain was a fluid situation, and it was often unavoidable. It was not about solving their financial problems. It was about understanding how their financial situation could affect their care outcomes. At a bi-weekly meeting, about 8 months after we started asking questions, one of the nurses told us how they were now asking all the clients about financial strain at their geriatric clinic. After hearing this, another nurse explained how their physician lead had just started asking the question as part of their standard practice. Another told us that a new physician who had recently arrived at the clinic had started asking the question as part of their routine practice. It was such a great feeling. We have plans for another education day to bring all the Kalina Country PCN staff together. I want to provide people a chance to share their stories with each other. When I share my story, I will tell everyone how much I grew through the process of implementing this project and how inspired I was watching them work through their fears and uncertainty. We have learned so much about financial strain, the community, and also a process we can use in other areas to continually improve the care we provide. In the end, it was so much more than just another question.